Hi everyone, welcome back to my channel. This week we're going to continue our interview with Tina as she shares her experience recovering with COVID-19. Recently, she heard news that rocked her world, and she will share that with us in the interview. So sit back, relax, and here we go. So this is our second video that we want to do in our
Right,
series of videos.
right.
And I just want to catch everybody up if they didn't watch the first video. So our first video was introducing Tina and her story about catching COVID-19 and how she contracted double pneumonia at the time.
Right.
Prior to her being admitted to the ER, she didn't realize how bad the virus was going to affect her
Mm,
until it affected her,
right.
and that she was admitted to the ER days before I would say she may have crossed over to the other side. I mean, it
Oh,
was
yeah.
really close. It was really close from what you
It
told me.
was closed. Yes, yes. It was very close.
Like,
Right.
and normally I would like to continue to chronicleize where we left off, but I know that you mentioned to me that something happened to your inside your family. So do you want to share that with everybody?
Yes, yes. My youngest brother was got COVID, and his wife as well. But I think about 4 or 5 days ago, he started to cough a lot, and my elder brother, who's a doctor, kept telling him to go to ER, and he said, "Oh, I'm okay." But then when I heard that, which was on Friday, this past
Right,
Friday, I said, if you cough a lot, that's the kind of symptom that I had too. And when you cough, it's coming from your chest, your lung. So I
right,
go, so we text each other in a group. I say, you know what? You got to go. And I said, go now, go today. You got to go because you can't trust this just because you don't feel so bad. And that's exactly what happened to me. I didn't feel that bad.
right.
That's what I thought. That's why I didn't go. But by the time I went, the doctor told me he wished I would have gone in about a few days sooner.
Wow. So,
So he didn't go until the next day, right? And then his oxygen level was 87. That's not
okay.
good.
Okay,
And then they did, yeah, go ahead. Just one thing. They
so,
did an X-ray on him, and he got pneumonia.
okay. So I want to ask a question because he was admitted this month, which is January, and then
Mm,
you were admitted in October.
right.
So being someone who had it last year, and I'm sure you must have told your family members to take precaution about what this virus is because you went through it.
Oh God, yes.
Did he or anyone in his family take any precautions in doing so? Because I'm sure if someone that I know
Hmm.
that experienced something that you went through, I would take that into heavy consideration because you're someone I trust. So I would really put some weight into what you tell me. So I just want to ask that question to you and whether you can explain that to everybody else.
It's a good question, Dean, because the way how everyone perceive us taking precaution is so different. And I mean, they were scared. They saw how what I went through. They were scared. And you know they wore masks all the time too, but I wasn't there with them all the time, so I don't know how much precaution that they have done. You see that? Because everyone understanding is so different. For
Right.
example, my sister-in-law, she got sick and she went outside into the living room just to like get some fresh air, but she thought that would be okay, right? But to me, it's like, no, because the air circulate. Another thing is they weren't aware they had a heater on at night because it's cold. But when you have a heater on, guess what? The air circulate. But this is something a lot of people don't think about it. But another one of my brother who's a doctor said, hey, you can't do that. You share that, air, and,
Right.
and then it's going to get everyone sick. So that's when they go, oh my gosh, they didn't realize that. So I just have to say, everyone is so different. And perhaps as much as they thought that they have been cautious about, how to, not get themselves sick, they probably expose themselves and, not careful as much. So everyone's different.
Okay. So you mentioned she. Can you explain who she is?
Oh, that's my sister-in-law, my brother's wife, my brother who got sick. So they
And
both
you
got
said that
sick.
she had symptoms. So did she test positive for COVID?
Yes, both of them test positive. She got symptom actually worse than him. She got fever. So this is interesting because I have seen this
Hmm.
pattern that some people got really sick and they didn't have to go to the hospital. They're okay, they recover. But there's those who are not that sick. They ended up in the hospital like myself. And I heard that on the news as well. The doctor said that a lot of time people who were admitted in the hospital, they weren't as bad, but then it hit them like the last few days. So
So
this,
like your brother then.
yes, and me too, the same
Okay.
thing. And that's why I pushed him, and he didn't go. And another brother who's a doctor, said I pushed him like 3 days before, and he just didn't think that was that bad, you
So
know.
how did that make you feel that he didn't want to go and you and your brother were pushing him to go to the ER?
Oh, I got upset because I said, God, I told you so. I told you so. And the thing is, Dean,
Hmm.
most people do not realize how bad this virus gets to you until you actually experience it yourself. And I'm not the one who's normally afraid of anything. I barely
Right.
get sick in my life. So if I get sick, I'm like, okay, whatever, right? I'll just go through it and I'll be okay.
Right.
But this experience in my life is totally different. This virus messed you up. Even after, look, it's on the fourth month now. I'm still not back to normal. I can't work out. I can only walk. I can't walk too much or walk too fast. I mean, this is crazy for someone who's athletic before, and
Right.
work out a
Right.
lot.
I
So
know. I know.
yeah, I mean, I'm like crazy when I worked out, I mean, 5 days CrossFit is a lot. On top of it, I go hike and, I work on and I work as a neuromuscular therapist, which is
Right.
fancy name for the massage therapist. I mean, all day long. That's a lot of physical. And still, I mean, I'm not back to, I still have to see a doctor. I mean, I went back to hospital. I mentioned to you, I went back to the hospital 3 times after the first discharge. So a
Right.
total of 4 admission, you
Right.
know.
Or admission. Wow. Okay.
So, Dean, so what it is a lot of people think it's not real. A lot of people think it's just a flu. And I did that too. I thought that too. A lot of people think, it's not bad. But when it hits you and look, a lot of people just like that drop dead like flies.
Okay. So let me take you back to, I believe it was Saturday, when you found out your brother was admitted to the ER
Right?
and that he had pneumonia in one lung, you said, right? And his oxygen was low.
I don't know if it's one lung or two lungs. I had bilateral, so both lungs for myself is bad.
Okay.
But
So
I,
how
mhm.
how did you feel when you heard that news that he was in the ER, pretty much in the same condition that you were in?
Oh God,
Were your oxygen level maybe like different, slight differences in certain
87.
things?
He had it at 87. Okay, I got mad. I'm really mad because I gave him the pulse oximeter.
What is that?
Okay, I have it here. I'm going to show it to you.
Hmm.
So, can you see this?
Yes.
Okay, so basically, this is called pulse oximeter. You can get it from Amazon.com, and this is such an important tool that everyone should have it. If you don't have COVID, it's good to have it. The reason is that if you ever get sick, try to check yourself every day, and it has a measurement of your oxygen saturation and also your heart rate pulse. If your oxygen saturation is below 95, you better pay attention because if it hits below 90, you are not doing you for sure may have COVID, and that's very dangerous to your lung. You need to get to ER right away, and they're gonna admit you. So if and basically this is a simple thing, you just put your fingers in and just press this button. But oftentimes most people just put it real quick. You gotta wait until like a couple minutes, for the reading to kind of stable. You see that 100 over. So my oxygen is good and my pulse It's good, 75. Can you see that, Dean?
Yep, I can see it.
So you leave it on for like a minute. If the reading doesn't look right, let go. Do it again one more time, just to double check. And the reason you have to do that is because sometimes you cough and you have a little bit of flu symptom, but if your oxygen saturation goes like below 95, you better be careful and keep checking it. Again, if it goes at 90 and below, the hospital will admit you. However, if it goes about 92, they won't admit you, but I think you can actually ask for them to keep you there, because I think 92 is very dangerous too. And the reason I say that, because I was in the hospital one time when I was admitted into the hospital third time. I saw a lady went in and she couldn't breathe, and her oxygen was 92, but the nurse sent her home. But that's their protocol, because the nurse never had that experience herself. I had experience myself. I knew that number 92 is, she can drop real quick in a day.
Right.
And I was like, oh boy, but who am I to tell the nurse? That's her
Right.
profession. But I'm the one who had that actual experience, so I knew it's like. And God forbid anything happened to that young lady, but if that happened and you're in low 90s, make sure that you request them to put you there. You can ask for that. They can't say, they want to send you home because they got too many patients, but you can insist of staying there, because I know that many times emergency, they will send you home quick, and many patients will go back worse and end up dying. And personally, I knew 2 persons who end up that way. So I
Wow.
was afraid
That's
of my
unfortunate.
brother. I was afraid when they discharged him last night. This is just only 2 days in the hospital. I was upset because it brought back memory. I was afraid that he may have to go back again and worse. But I understand a hospital is so overwhelmed too, so I just stay on top of him. And
Okay, so going back to the original question, you felt upset initially when you heard that he was admitted to the ER just
mhm.
because of what you went through and what you experienced. Hearing what you just said again about him being discharged from the hospital with, and I think you would have to share that he was discharged with his X-rays from what you saw. Um, how does that make you feel? So you first share how his X-rays were, and give a comparison to what your X-rays were, but you were still in the hospital.
Well, they did the
Then and then after share what about how him being discharged.
well, he had the first X-ray when he went in the first night, the first day,
Uh,
and then the second one yesterday afternoon. But it seemed to look worse. But that also could be inflammation or infiltrates. That could also be bacteria and viruses still there. But the doctor said that comparing to other patients, many patients that they have, he looks good. I
okay.
look good, but I was messed up, right?
Right.
So I was like, wow, can we perhaps ask to stay for 1 or 2 more days just to make sure that the X-ray improved before they released him? But they decided the doctor just said, you know what, he looks good. He can go home. They're just going to give him steroid and antibiotics, and they're going to give him the home health assistant. So they're going to send a person to show him how to do injection and how to use oxygen. Yes, he's coming home with oxygen tank. I just, well, luckily my brother, who's a doctor, lived with him. So, we're just going to have to monitor him. I stay on top of him as well. Knowing, having personal experience, I know exactly what he's going through, So I told my youngest brother, say, hey, just a little bit of difficult breathing or you're not feeling well, you better get to ER right away, because this virus hit you just like that, Dean. It's fast, and when it hits you so fast, it's dangerous. Yeah.
So him being discharged and your brother, who's a doctor, lives with them, could that be consideration why they potentially discharged him?
I don't think so because I don't think they know they live together.
Okay.
Yeah, I don't because my brother, who's a doctor, since he's a doctor, so he called them and stayed in communication with the doctor that my brother was admitted to. It's the same thing as in my situation. When I was admitted to my hospital, he was in communication with the doctor, who cared me.
Right.
But I don't think they know that they live together, so that was not, the reason. But I think the main reason is because most hospital will tend to, because especially in emergency, they tend to send people home quick, and especially now because they don't have enough beds, they have too
Right.
many patients. But so it's like you get a patient in and out, in and out, so they don't really get quality care. Right now, you better not get sick. You better take cautions extremely seriously, Dean. Because if you get sick and you have to be in the hospital, and this is going to happen to you, they're just going to give you some antibiotics, take an x-ray, and you're out. Care yourself at home because the next person can be worse, and they have to admit those person. And that's the best they can do, not because they don't want to care for you. I can understand that.
So they're
Yeah, it's not like
rationalizing care
no one's going to get the best care right now because
because
it's
the
too
system is
many.
overtaxed.
Yes, and that's why it's so important. I mean, this is real, this is dangerous, and it's impossible for me to kind of express what it's exactly like until you go through it yourself. And I don't think you want to go through what I go through. Like right now, I'm like having to take a deep breath. Fourth month now, I'm still like messed up. Affect your lungs, your heart, your blood, your brain, your nervous system, your skin. It's everything. And nobody really know much about this virus yet. Okay, they're trying to control it. So Dean, this is one of the main reason why we decide to do this video, because people have to know. I mean, I'm someone who's never been afraid.
Right.
I'm someone who's just like,
Right.
now I'm like, I freaked out because the experience wasn't that pleasant. I even have PTSD. That
Can you explain more about the PTSD that you experienced?
I got anxiety, panic, because every time when my heart palpitate, I start to get panicked. Or every time when my oxygen level goes low, I get panicked. When I listen to the news, because now since when I got discharged, before I never listened about COVID, I just go, now after the hospital first discharge, I listen to every single story, every doctor's, so I can learn more about it. But also I think at the same time, finding out all this breakout and hospital doesn't have enough bed, my fear and my anxiety is like, what if I have to go back again? What kind of help would I get?
Right.
Right? That's serious stuff, Dean.
Yeah, that would scare me too.
I like to share with you one thing, that it took about 2 months to get appointment
Wait,
on
two
the
months?
phone with my lung
You
doctor.
said 2 months, right?
2 months to make appointment with the lung doctor on the phone. I never seen my lung doctor in person.
Wow.
And the next appointment is not until June.
June.
Yes.
6 months.
So 6 months after the first appointment on the phone. And then
Wow.
he told me that he will order lungs rehab and lungs function. I haven't heard for a month and a half now. So I called and they told me that yes, they got an order, but they cannot make appointment right now because they're short of staff. And everybody has to be helping those in the ICU who are in a critical condition right now. So all the appointments got pushed back. You see that? So that means I'm on my own.
Wow.
I gotta wait until they are slow down, which who know when, because if the breakout continue until summer or fall, all I'm gonna get is a phone call with my doctor in June. He never get to like I never get to have an X-ray. That's why I have to like call my family doctor and see if he can even order me an X-ray and CT scan, which my family doctor did. You know, but it took months to get that. This is a kind of healthcare service that we are going to get now. So I would like everyone to be aware of that. They're not aware of this at all. And a lockdown in California makes it worse. They push everything. So I just kind of like, wow, pretty much we have to educate ourselves. We have to listen to those who have experienced this before. And you hear on the news, a lot of people are gone left and right.
Right.
That's not a joke. That's real. That's serious. I was one of them who almost there, and just to warn everyone to wear a mask, try not to socialize, because when you do that just with your family, you also risk your own family as well. And you never want to have to go to a hospital because it's going to be hours for you to see a doctor, and who knows if you're going to make it. Yeah.
So you're saying that you have to be on top of it, such as any appointments, any follow-ups that you have to do, just because from your experience, it seems longer than normal.
It is a
Is that
lot longer
right?
than normal. Yes, normally they will call you. My doctor will call me, and we'll have a appointment. I will receive a letter with my appointment, or the nurse will call. Now it's different. I don't hear from them. I don't get the letter, and they push my appointment. I had no idea because they never sent a letter because they're so overwhelmed. I can see that, and I have to keep calling just to see if the lung doctor has any cancellation. I call every day, 3 times a day, for 1 month, 1.5 months. No cancellation because
Wow.
they have so many patients who's gone through COVID um, pneumonia. And
Wow.
I was like, wow, it's so difficult to get help and care, and it's going to get worse because more and more people are, you know, flooded into the hospital right now, into the healthcare system. It's going
Right.
to get worse. So what can we do? We need to really learn because they're still learning. The doctor doesn't have answer to what to do. I asked my doctor, what should I do? He said, well, we don't really know as well. And the doctor never experiences themselves. Some do, I'm sure, but majority of them don't. So they said just work out, go walk, and use spirometer that they give to me. I'm just going to show you real quick. This is it's called spirometer that they give to me from the hospital that we need to blow to exercise our lung every day, and we should do that. And even if you don't have COVID, that's not a bad idea to exercise with this link, Dean, to strengthen your lung.
That's a good idea.
Yes, yes, definitely. You can get from Amazon. It's like less than $10. Get it now before it goes up because I noticed that when I bought this pulse oximeter, it was only like 17, 16, 17. Now it's $25. I just ordered an extra one yesterday.
Wow.
So it's been going up because a lot of people are buying it, you know, but it's a lifesaver. And all the doctor will tell you that you should get it. Hmm.
I
You
know
have one
that you
yourself?
actually I have one.
Good. Yeah, I
I
think
know that you touched point about the healthcare workers and how they're being overworked at this time. Uh, so I know that what you went through, you must feel a lot of deep appreciation to them and what
yeah.
they're going through.
Hmm.
Is that right?
Well, yeah, yeah. I like to share this with you. I know some of them are so afraid of catching COVID. I understand. But I'll tell you that we're being isolated. We can't have any visitors, and you isolate in this room by yourself, Dean. And when you're not feeling well, you become so vulnerable. And I remember the first nurse in the ER,
Mm-hmm.
she As soon as she found out that I need to have all this medication, IV and steroid, she turned me over. She got another nurse to help, and because I wasn't able to move, she turned me over, flipped me, face down in prone position, because that's important.
Okay.
Uh, and she would bring me food, bring me drink. She's constantly coming to my room. And I remember before she checked out from her shift, I was out, and she's like, "Wake up, Tina, wake up." And she just grabbed my head up, looking at her. She said, "Look at me, look at me." And I was like, oh. And she said, "I'm getting off my shift." But she said, "You're gonna be okay. You're gonna be okay. I love you. Angels
That's
looking out
sweet.
for you."
That's so sweet.
I don't know who she is. She's just my nurse one shift in an ER. But she made a very important impression on my emotion. You don't know how I felt that moment. And there were a few nurses there when they transferred me into the hospital. There were a few nurses really, really caring, and they were there. They talked. They told me what to do. One of the nurses actually got COVID herself, and she went through it. And when you get a lot of this care from them, and they show how much they care for you, and you don't have anyone around, you don't have your friends, your family around, they're the one that you feel like you want their help. You want them to be around you.
Right.
So when you felt that care from them, you feel that compassion and that help. They they clean you up, they feed you, they change the bed sheet for you, change your clothes. It makes you feel comfort. It makes you feel care. So they play a major role, the nurses. And I just want to thank to all the nurses out there. I can see them running around a lot. It's a lot for them. They told me that they normally got 3 patients,
Mm-hmm.
but now they ended up with 6 patients, double.
Wow.
Hmm. My eyes tearing. Sorry, it got me. But
Oh,
kind of take me back into that moment by myself. It was it was a lonely moment,
mm-hmm.
scary moment, and I think that's what caused this PTSD or anxiety, and that happened to everyone who has gone through the same as I did. Sorry,
No, that's okay.
I didn't expect
Take
this.
it. Take your time.
Dean, I didn't expect this.
Take your time. Take your time.
Yeah, okay. Yeah, no, I'm good. I'm good. I'm good. I'm just I just remember some of the nurse. My God, it's but they play important role. When they show care, they show compassion. And it's not easy for them.
Right.
And it does take them a long time to take care of one patient. I mean, just me alone, it would be like half an hour, clean up, medications, get the labs, get my blood, x-ray, and all kind of stuff. It's like all day long. And yeah, so, all right, I'm back.
Okay.
Sorry.
No, that's fine. So again, you are wanting to express your gratitude to those nurses that helped you out in your initial time at the hospital,
And a
and
doctor
to
too.
and to every healthcare worker that's in this right now. Because
Yeah.
without them, I mean, they're indispensable. I mean, they're vital for everything.
They need extra pay, seriously, because I I support that because you know what? It's
Mhm.
okay. They have to work in the environment that they're exposed to this virus, and they can get contaminated. They can get sick themselves.
Right.
They are afraid. I know that they are afraid. Some of them are really freaking out, But what can they do? This is their job, you know, and they have to wear all these wraps around them, which is so hot and uncomfortable, and double mask. I mean, and then the helmet. This is so difficult for them to breathe as well. And that's like talking about 12-hour shift. That's not easy, right?
Right.
So I can feel bad for them. And the doctor, I mean, I was lucky. I have amazing doctor, that's really caring. He came in, check up on me every day. I mean, that is such a important to see this healthcare worker who really, really love what they do, and they really care for their patients, you know. So I just wanted to shout out to those doctors and nurses that really take care of the COVID patient quite well. It's not easy.
Um,
You're talking about fears involved, fear of getting this virus because it's very contagious. At the same time, it's just like they're surrounded by all this virus. Every patient, not easy.
right, right, right.
Stressful for them. Yeah.
Okay.
So
So I think right now, how are you feeling? Because I know you're still recovering and it still takes some time for you to
I'm still
like,
not. I'm still not back to normal right now. This is the fourth month, going on the fourth month. Dean, I still. This is what I noticed, and I think this happened to many too. I just found out. I remember I told you I feel good after the first month,
right,
and it revert back, and then I ended up in the ER again for another week. Then I come out, and I start to get a little better, and then it revert back again, and now it's like revert back again. You know, to where I can't take a full breath sometimes, or like when I walk. I mean, I'm just tired. Like right now, it's weird because everything I eat, I can't eat too much or too fast because I would not be able to breathe, take a deep breath. So I still can't work out. I mean, I can walk, but I can't do weightlifting or CrossFit, nothing like
right,
that. No, impossible because my heart just palpitates too fast. So it's kind of like going back and forth. And, I found out from, I think was one of the YouTube that many patients actually have that. You have to kind of take it slow sometimes. So I'm kind of learning how to heal myself. So in a way, this is like walking alone on your journey of healing.
right, right,
And I need to use what do I know, and especially being therapist myself, I kind of understand somewhat, and so I try to exercise my lungs. And when I feel the muscle aches in my lung, I need to kind of rest for a couple of days, and then come right back again. But one thing though, Dean, the first couple months, I was depressed. Hello. So I was depressed. I was discouraged. I didn't know what to do. But now my attitude is different because what else can I do now? All I can do right now is to put my best and to stay positive and to help other people if I can, like this, you know, um, being raw, come out here and express what my experience, because I used to like, yeah, I don't know if I'm gonna do this.
right.
But I realized, you know what? Because like I'm very self-conscious. I'm someone who's conscious. I gained so much weight with all my medication. My face right now is like a balloon. Like I have a fillers all over my face. Like, I seriously, and I'm like probably 30, 40 pounds bigger. I mean, I'm like, it's so embarrassing in being in front of TV, show the whole world. But you know what? I just don't care. I just want to be me, being real, and just want to share with everyone what I have gone through because I don't want anyone to go through what I've gone through.